English.
Yes, thank you.
Questions will also be in English.
That would be helpful, yes.
Very
Thank
good.
you. Good morning. First off, on behalf of both the Swedish and American, as well as our distributors around the world, I'd like to thank you for coming out to hear a little bit about what we do here. The product that Dignitana provides to the market is very important to everybody in our company, and it's always our pleasure to be able to let more people know about what we do and the benefit our product provides to thousands of patients around the world each year. So today what I'd like to do is spend a little bit of time talking to you about who we are as a company, what we do and how we do it, what does the market for our product look like around the world, and then finally, what's the investment case for Dignitana AB. First off, the company Dignitana AB, we're headquartered in Lund, Sweden, which is where the company was founded in 1999. The company was actually founded by a Swedish oncology nurse, Yvonne Olofsson, who had recognized that hair loss, especially for female patients during chemotherapy, was just about, if not the most distressing, one of the most distressing side effects of chemotherapy. Most of the other side effects of chemo, nausea, and some of the other things, were all being addressed. However, the hair loss associated with chemotherapy was not. So as an oncology nurse, she acutely saw the need to try and mitigate this side effect and started the company in 1999. The company was taken public on the Aktiedagen market in 2009. We started our clinical trial in the United States in 2010. Company then moved to the First North Stock Exchange in 2011. Today, with a little bit of momentum behind us, the market cap of the company is just under 200 million SEK. We're traded again on the First North under the ticker symbol DIGN. Swedish operations are based in Lund, U.S. operations, where the majority of activities of the company are located, are in Dallas, Texas. The product that we provide the market is the DigniCap scalp cooling system, and what that scalp cooling system does is reduce a patient's localized scalp temperature during chemotherapy, and what that does is mitigate the losses, hair loss typically associated with many chemotherapy regimens. Our mission is to help patients get through one of the most difficult times of their life with some more dignity, control, and anonymity. We're very fortunate to have a really good board of directors, which we reconstituted at the end of last year. We didn't list all of their achievements simply because there's just too many of them. We welcome you to go to the website to see more. But Thomas Kelly, who's our chairman, based in Chicago. Tom is managing director of KMK Associates, which is a private equity firm based in Chicago. Tom has very significant public and private market experience, as well as operating experience with large and smaller companies. Myself, I'm the CEO of both AB and Inc., the U.S. subsidiaries. Mikael Wahlgren, who is based in Lund, was the former general counsel of Alfa Laval. He is also chairman of another First North traded company, Arc Aroma, as well as being chairman of two additional companies, Nataro Labs and also Grandman AB. Ingrid Atterud-Hyman, who had actually presented earlier today as chairwoman of DOXA, has very significant healthcare and public market experience as chair of both DOXA and Ellen, who previously presented today as well. So we're very fortunate, again, to have a very significant group of members on our board. The organization looks like such. We have 24 full-time employees spread between Lund and the United States. Again, I'm both chief executive AB and Inc., but also of an Italian subsidiary we recently created in order to do more business in the Italian market, which I'll get into later. 3 folks full-time in Lund, the rest spread across the United States. Dallas, our headquarters. We also have sales folks and support people in Los Angeles, New York, Florida, and Denver. We maintain a global presence directly selling into both the United States and continental Europe, but we also maintain a series of distributors to place the product in markets that we don't cover directly. Presently, we've got our device in over 34 countries around the world. Recently, early this year, we took our distributorship back for continental Europe from Sysmex. We now have direct sales and marketing for both the United States and Europe. Those are primarily the larger concentrations of cancer patients worldwide. Asia is also a tremendous opportunity for us that we are working with Konica Minolta to derive a go-to-market strategy for Japan and China right now as well. And then we also distribute the product across the Middle East, South America, and Australia. The company continues to grow. We were cleared by the FDA in 2015, late 2015. The United States is our primary market and approximately 80% of our revenues. From the chart, you can see our last quarter, Q2 of 18, represented a very significant growth milestone for us in that one, it was the first quarter we'd achieved as a company over $1 million US in revenue. And we were able to dramatically decrease our per share loss also by, again, an increase in the revenue base coupled with a decrease in our overall expenditures. Late 2017, early 2018, we moved the vast majority of our administrative functions from Sweden to the US. This has helped us really streamline our process in terms of sales, marketing, and product development, which I'll touch on in a little bit. What is scalp cooling? By hypothermically reducing a patient's scalp temperature, localized scalp temperature, we're talking only reducing the temperature a couple of millimeters down in the scalp. What you're able to do is reduce blood flow in that localized area, but you're also able to slow metabolic processes. So normal cellular activity while the patient's scalp temperature is reduced is slowed. So the absorption of the chemotherapy agents during the infusion is limited, and as such, the toxic effects on the hair follicle is also mitigated. Why do patients want scalp cooling? Really, there's three primary reasons. For most, especially females, females are our primary target market, but we also do treat a fair number of male patients as well. But for most, there are three reasons why they want to employ scalp cooling. One, to maintain a level of anonymity. Going through chemotherapy is really one of the most miserable experiences for most patients. And I know this firsthand. The reason I'm involved in this product and this company is my wife was diagnosed with breast cancer in 2011 and used scalp cooling to mitigate her hair loss during her chemotherapy sessions. That was prior to the clearance of the Dignitana product, but her reason, privacy. Just as soon as you lose your hair, you become known as a cancer victim. It's very hard to hide that and maintain anonymity. So by employing our product and mitigating that hair loss, reducing the hair loss, or eliminating the hair loss, you're able to control who, when, how much people are aware about your illness. Control. Again, during chemotherapy, this is a really difficult time in people's lives, and this is one area that they can control if they so choose. And for a tremendous number of women, their hair is their identity. So this product, this therapy option, enables them to, again, afford some level of control, maintain some level of control that they would otherwise not be able to have. Again, women are our primary market, breast, ovarian, uterine cancer. When we were doing our early market research, we found that 96% of women, when posed the question, would you be interested in maintaining some or mitigating your hair loss during chemo, would you be interested? And the answer was a resounding yes. The company itself was started again 1999, but scalp cooling has actually been around since the 1970s. The science behind this is really not too difficult. So this was originally, people tried to mitigate hair loss through putting bags of crushed ice or even frozen peas on their head. When Yvonne Olvesen created the first device in 1999, that was the first device-driven solution to address this issue. The company then brought the product to market, Europe, Australia, South America, et cetera, starting in 2009, again, through today. In 2015, the trial in the United States was actually started in 2010. So it took 5 years to get market approval by the FDA in the United States. So the approval was granted, or clearance as it's actually known for devices, in December of 2015. We started placing the first devices in 2016. There was a very large Journal of American Medicine article published by our lead PI, Dr. Hope Rugo at UC San Francisco, in February of 2017. Originally, the device was cleared for female breast cancer patients. In 2017, July of 2017, we had that indication expanded for all solid tumor cancers, male or female, so that was a very significant increase in our potential market. Presently in the United States, we have our product in over 100 cancer treatment facilities, and we're in 34 countries around the world. What is the product? This is the DigniCap product today. The device itself, next to the patient's chair. The chair is not part of our device. That's just a standard infusion chair. And there's three components to it: the cap that delivers the therapy, the Dignitherm, which goes over the outside of the cap just to provide an insulative factor, and then the device itself, which sends the chilled liquid to the patient, to the cap. Again, three components to it: the inner cap, outer cap, and one of our recent enhancements to the outer cap is grafting the BOA closure system around the top. And what that helps to do is really provide a very tight fit to the patient's head. The better the fit to the patient's head, the better the patient's outcome is. And that's been a tremendous enhancement that makes fitting the cap easier and outcomes better for us. That was just launched last year for us, and again, very, very significant enhancement to the product. Product development is a really big part of where we're at right now. This system itself was developed about 10 years ago. There's been some enhancements along the way, but a newer device that provides a lot more benefits is really what we're trying to provide to our sites and to new sites around the world. The device we have today treats 2 patients simultaneously or independently. What we find, and especially in the United States, there are a lot of single patient infusion rooms, so that device, 1, is too big and 2, has too much capacity. So we're coming to market with a smaller sized unit that treats 1 patient at a time. The software will make it dramatically easier for both the patient and the provider, significantly decreasing the amount of nursing time attributable to providing this therapy option for patients, and the improved user interface, the software that we're bringing to market also is a dramatic improvement. What's the market for scalp cooling look like? The United States has over 800,000 incidences of solid tumor cancers each year, 1.6 million new cases of cancer each year in the United States. The device itself is contraindicated for hematological cancers. So leukemias, blood cancers, we are not able to treat patients suffering from those malignancies. So what we really focus on are solid tumor cancers. Each year, again, 800,000 new cases of those. The preliminary indication we received to treat was female breast. That is still the vast majority of patients that we treat. Over 255,000 new cases of those per annum in the United States. Each year, there are 14 million new cancer diagnoses worldwide. Of those, 8 million are solid tumor cancers. Breast cancer, again, but with the expanded indication that we received last year, the number of patients we are treating for ovarian, uterine cancers, lung, et cetera, continues to climb as well. One interesting note is that 8% of female patients will refuse chemotherapy altogether, simply for fear of hair loss. That 8% cohort is an enormous percentage of the population that can use our device to receive the chemotherapy that will ultimately make them healthy. Company highlights, very solid foundation. The company, again, is started in 1999, so we have a 20-year track record providing this therapy option. We now have a very diversified revenue stream. In the United States, we provide a pay-per-treatment model where patients pay per treatment. Outside the U.S., the devices have been sold, and some have maintenance contracts that provide an ongoing revenue stream. Others have been leased. So we now have, through sales, pay-per-treatment, service, and maintenance fees, a very diverse revenue stream coming into the company. We have a strong and existing and a recurring market. Again, every year there are 14 million new incidences of cancer worldwide. Those numbers increase, unfortunately, each year as well. The expansion of our indication from female breast to all solid tumor cancers basically tripled the size of the market for us in the United States. And we continue to grow on a very rapid pace. Reimbursement right now in the United States, it's all patient pay. We anticipate sometime in the future that insurers will provide reimbursement to their insureds. Right now, about 20% of patients in the United States that apply for reimbursement from their provider is receiving some level of reimbursement. We anticipate that number to do nothing but increase. We have some very significant cancer centers. National Cancer Institute designated centers are the best of the best. We have 10 of those thus far in the United States. What does the investment case for the company look like? Again, the U.S. is our primary market, but by taking Europe back from Sysmex and also our opportunities overseas, we have a very large and expanding marketplace. The market for scalp cooling in the United States for breast cancer alone is about a $275 million business. Adding in the other solid tumor cancers, it basically brings us over $700 million in potential revenue opportunities just in the U.S. alone. Since we came to market in the United States, first quarter of 2016, our quarterly revenue numbers have increased each and every quarter, representing a just under 62% compound annual growth rate since the introduction of the product in Q1. That's just for our Inc. revenues alone. What are the initiatives that we're presently coming to market with? Primarily, it's to launch the next generation device. The first device that we got cleared is what got us into the game. However, to really grab the opportunity in front of us, we need to provide an easier experience for the operator of the device. Primarily, it's the oncology nurse that has to administer the therapy, and right now, each infusion takes almost an hour's worth of nursing time. The new device drops that to about 10 minutes per infusion. So that's really one of the primary inhibitors to the rapid growth we know that's available that this market can provide us. We need to continue to build on the growing momentum and demand for the product. As awareness continues to be raised, then more people want this therapy. We just need to be able to deliver more devices to more facilities. To do that, we are now very aggressively focusing in the U.S. on multi-site operators. There are your research facilities, then there are community oncology providers that can operate 10, 20, 50, or even 100 different infusion sites. Those are our primary opportunity markets. In the U.S., we need to just provide more salespeople on the ground as well. And then as our opportunities increase around the world, we need to provide more sales folks there. One of our biggest opportunities is Asia. Thus far, we've not done virtually any treatments or sales in Asia. Konica Minolta is our Asian distribution partner, and we are working aggressively with them to open up both the Japanese and Chinese markets. That should do it. Thank you.
please come over here to the table, and I think there's a white mark there. That's where you're supposed to stand.
Standing.
Interesting company. You don't treat a disease, but you treat something that comes with the disease, or with the treatment of the disease, which is very annoying and embarrassing, etc. Could you elaborate a little bit more about the business model? I mean, you said that you had a diverse one, but I would like to hear what's the preferred one.
The preferred model is a pay-per-treatment model, where what we employ in the United States is we lease devices to the facilities, and then patients pay per treatment. Each time they use the device, they pay for that treatment. So what that does is create an ongoing revenue stream per device, per facility. Previously, the company had sold devices outside the United States. Prior to receiving clearance to market the product in the US, all the devices had been sold, basically through distributors who then sold them on to end sites. So the only recurring revenue opportunity was perhaps a service and maintenance agreement, which is fractional to what the pay-per-treatment model presents.
Are there any consumables that you can make money on?
The next device is the next generation device that we're presently working to present to FDA shortly has a consumable product.
Because I think in medical technology like this, the instrument per se, you could probably just place in the clinic and then make a lot of money on the consumables. So there's an option there to introduce consumables.
Yes, that's correct. And the standard device model does involve a standalone system or device, and then the recurring revenue does come from the consumables that are utilized each time that device or console is employed, and that's the model that we're moving to.
The cap that we saw, those yellow, red, blue, and are they consumables or are they reused?
Right now they're reused. That's what we will be moving towards, a consumable cap model, yes sir.
Okay, and could it be like a patient who uses this for maybe 1 month, because hopefully the patients will not use it more than 1 or 2 months?
It's about 4 months actually.
It's 4 months, okay. Yes. Will they have their personal cap? Or is it a new cap every time?
It's a new cap every time.
So it's one.
Yes, sir.
Okay. So we have some question here on competitors, and I guess there's a Swedish company, Paxman.
They're actually a British company, but they are also listed on the First North.
Okay, so there's an AB.
Correct.
And then there's another one, Penguin or Pingu, or what is something?
Yeah, there is. That is what is referred to as a gel cap provider. Okay. Penguin is a non-electromechanical solution. It's a cap that is either put in a freezer or a cooler with dry ice.
Let's skip that.
They're not FDA cleared.
That's right. Pacman is more a true competitor that have roughly the same type of technology, a cap, etc. So the question was, what's your competitive advantages to Pacman when it comes to the technology? Why should they use Dignitana and not Pacman?
Sure. Paxman is a very good both competitor and product. We differentiate ourselves primarily right now in the United States by level of service. The way I put it for a device like this is no matter how much the patients want it, no matter how much the facility wants to offer it, it does not come without significant logistical hurdles. And to ensure the device is used properly, patients and providers are following the protocol to ensure the best outcome requires a very significant level of support, both for the patient and the facility, training, retraining, as well. Once the patient has their first infusion, they have questions. Typically, patients are going to lose some hair about 17 to 21 days after the first infusion. No matter how well you prepare them, no matter how much they may have been told, they're going to lose some hair. Once it starts, they want to be reassured. This is normal, and it's going to stop. So we provide a very significant patient support and facility support program to stay with our patients, to ensure they stay with the product and receive maximum benefit from it. That's one of the primary competitive advantages.
Yeah.
As we bring the newer generation technology to market, we also believe there are significant competitive advantages in terms of product usability and outcomes as well, vis-a-vis the Paxman device today.
Okay. In the one of the latest reports, you talked about quality issues with your product or production. Could you elaborate on the quality issue? Have you solved them? Or because quality issues on medical devices could be devastating.
Sure, absolutely. One of the issues that the existing device presents is we operate on a global basis. Again, we're in 34 countries, and what that means is you're operating across multiple different electrical infrastructures. Japan runs on 100 volt. India runs on 235. We're at 115. The existing device and its design have had some issues operating across multiple power ranges. So the new device is being constructed specifically with a variable power supply. All we need to do is change the plug that goes into the wall, and the device will operate the same no matter which market you're operating in.
Yeah. Looking at your 6-month report, 2018, you had a revenue of roughly 15 million. You have a cost of roughly 23. If you extrapolate that to 12 months, means that you will have a result of minus 16. Revenue of 13 and 30 and a cost of 46. Of course, this is extrapolated numbers, everything, the next 6 months. I guess my question is, how will you change that? Because you want to see more sales, revenue coming in.
Sure. If you noticed from Q1 to Q2, our revenue jumped 51% quarter over quarter. Yeah. And second quarter, our expenses were significantly lower. The first quarter, we took a tremendous amount of expense as we transitioned most of the administrative functions from Sweden to the United States. Yeah. So Q4, for example, we had 12 full-time employees in Lund. We now have 3. Yeah. So we have dramatically reduced our infrastructure and costs associated with running our non-U.S. operation, while we have not had a commensurate increase either in headcount or expense in the United States. So what drove the dramatically reduced loss per share this quarter was both the higher revenue and lower costs. So the first quarter really represented sort of the last of our inflated cost infrastructure, and now we anticipate revenues to do nothing but increase as well.
Okay. Swedish people are sometimes concerned that good companies are leaving the country. You have left operational the country. But you're still on the First North. Will you stay as a Swedish AB, or will we see you in a couple of years as an Inc?
No, we do anticipate staying as an AB company. In fact, ultimately, we anticipate increasing our headcount over here. What we just really needed to do was focus on device development, and the U.S. is our primary marketplace, so the disjoint between our U.S. and our Swedish operation just wasn't providing us with the efficiencies to get that new device to market in the format that we needed it to be as quickly as possible. So we will maintain our footprint here in Sweden, and as we bring this new device to market, we ultimately anticipate the headcount here both increasing. This will be our base to grow our European business from, and with our existing device, it's still our main support infrastructure.
Very good. Thank you very much, William, and good luck.
Appreciate it. Thank you.